We have Dr. Rajkumar, Senior Consultant, Cosmetic and Plastic Surgeon with us. Hello, sir.
Hello.
So, what is actually cosmetic surgeries and what are the common types with them?
Nowadays, now the people have some concerning the female. A breast remains an important problem. In case of enlarged breast, the patient has severe back pain and neck pain. So the people think that there is no solution for it. No, it's not like that. The back pain and neck pain is caused mainly because of the enlarged breast. So the breast reduction is done not only for a cosmetic issue, it is done also for a functional reasons to relieve the pain as well as that to avoid unusual circumstances they have it. So the other common cosmetic procedure the patient is acquiring today is breast augmentation. See that it is done for both purposes, for reconstructive as well as for the functional reason. Because in some females, by birth itself or by post-lactation, that is after pregnancy or lactation, there is called as post-lactational atrophy of the breast. So in some cases, by congenital or by birth itself, the breast is not enlarged. In these cases, and there is a syndrome also associated with Poland syndrome, in these sort of circumstances, the breast needs to be augmented. Nowadays, what we do is a silicone implant is a common thing we do. There is a simple procedure by which our breast size can be increased so that the patient psychology is improved and all these things. It is not only done for a cosmetic, some people is done for a cosmetic also. That is, they want to further increase in the size of the breast, so it is done for a cosmetic purposes. And the other common procedures in females that we come across is tummy tuck. What it means actually, after pregnancy, because during pregnancy the abdomen is stretched and the skin is got relaxed. Though all the females try to do the postpartum exercises, sometimes the recoiling of the skin is not achieved in certain patients. So in those cases, the skin remains flabby and loose. So and the striae marks also, what we call it as stretch marks, that also persist. And then for these patients to improve that contour and then to get back that normal tone, what we call it as tummy tuck. It is nothing but a classical abdominoplasty. Suppose if the patient has a good umbilicus, we retain the good umbilicus. We make an incision where the incision is made for cesarean and try to elevate and go up to that costal margin and bring back and remove the excess laxed skin, and then we try to give a good shape of abdomen, very good contour, and to bring back that same contours what they have previously. So these are the common procedures that we do actually.
You just explained about tummy tucks, right?
Yeah.
But what is the difference between tummy tucks as well as liposuction? That is also
actually both are interrelated or entirely different also. You can put in both ways actually. Liposuction is a very accepted theory. It has come up because the number of fat cells in the body is constant. Suppose if you take the abdomen, male abdomen, the number of, for example, cells is 1,000. It doesn't multiply. It doesn't have the property of becoming 1,000 to 2,000, but it has the property of only increasing in size. So with that theory, we used to capture that technique and try to use this by the liposuction method, where we use a very good machine called micro. We make a small holes in the just below the crease lines, and then try to inject some fluids which dissolves the fat, and we suck out the excess fat that has been stored in the abdomen. So if you talk about that differentiate with tummy tuck and liposuction, and in combining with tummy tuck, the patient will have a loose handle called, they have a loose excess fat in the side as well as at the back. Whereas in case of male, they have a huge stomach. So for these areas, we try to do that procedure and try to suck out that excess fat. And the other areas that it has been where there is a isolated collection of excess fat, like the underarm, we can do. Some people have excess fat in the buttock, and then they have the thighs on the lateral aspect, on the thigh in the medial aspect, and then all these areas. Some people have some excess fat called as below the chin, so double chin. So in all these areas where we have excess fat, we want to reduce the fat and the contour, we do this procedure called liposuction. One thing is you should understand in liposuction, it is not an alternative to exercise. It helps you to, in one of the way of reducing the weight in case of liposuction. See, if you do your exercise regularly, still you feel that your abdomen is not coming down, your underarm is not reduced. In those cases, we help you to to contour it. It is mainly to use for the purpose of contouring the abdomen. It is not an alternative to weight reduction. So weight reduction comes in a different scenario called the bariatric surgery. Bariatric surgery is entirely a different issue where if you want to reduce the excess weight, suppose if your weight goes above 120 or 130 like that, where the overall body structure is enlarged like that from the arm to the foot like that. In those cases, if you want to do a weight reduction, you have to go for a bariatric surgery if the BMI is very high. BMI is calculated based on our weight and height, and then it is done. So we have to understand where we have to do the bariatric surgery, where we have to go do the liposuction. That is one thing. And it gives a promising results. And post-operatively, if you do the liposuction, you have to wear the pressure garment like that for 3 to 6 months, which contours and controls the excessive secretions. In that way, liposuction helps us to contour our body. That is a very important, everybody seeks for it, and many people are now coming up to get the body contour. That is, you should understand.
Okay. Doctor, you just spoke about liposuction and the difference between liposuction as well as tummy tucks.
Yeah.
In terms of facial surgeries, what are different types of facial surgeries that's happening?
As rightly, you know that our always the nose is a prominent part of our face. So everybody, when there is any problem in the nose, many people wants to correct the nose. So sometimes during the child also during playing they will fall, and then they would have some fracture or some deviation will be there that will be left untreated, and when they grow up actually, so these things will manifest in a bigger way. Some people by nature itself that there will be a wide nose at the base, and then there will be a big hump over the dorsum of the nose. That looks prominent because since it remains the most prominent part, it looks very prominent as needs some problem, as needs some corrections actually. So the other thing is called as rhinoplasty or nose surgery. That is a common thing. People ask for it, and these are the things we do. We can reduce the base of the nose. We can reduce the hump as well. We can correct the deviation. There are two reasons for deviation. One is the internal and external. Internal maybe due to that septum causes sinus problem. The other external also, it is due to that deviated. Both may be combined. So these are one of the common things which needs correction. Sometimes it is associated with obstruction of the nose also. So that has to be addressed along with that. So it is done both for a functional as well as for a cosmetic reason. And the other facial surgeries that commonly people ask or we do it is as the age advances, that is called as blepharoplasty. Is nothing but the collection of fat under the eye, that is called as baggy eye. So we make a small incision and try to remove that excess fat and give that normal even contour look. That is one thing. And then sometimes some people have as the age progresses, the eyebrow will sag, so we do the brow lift. That is another important procedure that people ask for it. And then if in case we do a facelift also, where they have an excess wrinkles and shrinkage of skin, both involves face and neck as well as. In those cases we do facelift as well as neck lift. It has to be combined. The other common things are if they have a small wrinkles or depressions, patients come for asking in those cases. Those things we do Botox to reduce that wrinkles, and then sometimes we use fillers to correct the depressions and make that even. So these are some of the facial procedures that are commonly done. Even some people have come for an enlarged lip. So they feel that the lip is enlarged compared to the upper lip or lower lip, or compared with other people's, they comparing with other celebrities, and then they feel that the lip is very enlarged. We do a lip reduction and then to get the correct contour. So these are the procedures that has been done commonly.
So this facial surgeries, I think it's overall a personality development that I think everyone would like to have in order to improve their way of appearance. Does hair transplant also comes under the same category?
Yeah, definitely. See, nowadays, even before marriage itself, many people lose their hair and get the frontal baldness and the receding hairline. It has become a very common thing. Hair transplant is a very common procedure, very easily done, and what you should understand it is what method we do. Previously we are using strip method. Now what we do is FEU. That FEU method, we take individual hair from the behind and try to implant along with the root into the area where we want actually. It is a time-consuming process, but it gives a promising results. It is a natural way of treating that baldness, where you can go for shaving after that transplant. It can be a normal laser as like any other hair, and it is very promising results also it produces. We try to do maximum around 2000 to 2000 follicles per sittings and try to fill that area where it is flat. Sometimes people have baldness in the mustache also, sometimes in the eyebrow, and then usually we used to take that from the behind, because that is the area very less sensitive to hormones. That is further hair fall. It's a very natural way of treating the baldness, and it gives a promising results and good results.
Thank you so much, Doctor, for providing your valuable time as well as providing very useful information to us. Thank you, Doctor.
Thank you.